In this lesson, I'm going to explain precipitous labor to you and then how you will provide care for this patient. Let's define what this is. So precipitous labor is a labor that from start to finish is under 3 hours, so less than 3 hours. This is super fast. Labor is usually 12 hours or even longer for some, just to give you an idea. So these are the patients that barely make it to the hospital, or they don't even make it to the hospital. They deliver in the car, in the emergency room, or they're being wheeled in and they're sitting to one side. That lean is never a good sign, I can tell you. It means that there is a baby very close to being between her legs. So super fast, precipitous labor. Our patients that are going to be more at risk for this, it really can happen to anyone, but those that are a multigravida, a patient that has had pregnancies before, they are going to be more at risk for it. Also, if they have a history, if they've done this before, then sure enough, they're probably going to do it again. All right, so when we assess this patient, she is going to have rapid progression. So she is going to have contractions that are super close together, very strong. The patient also might have a feeling of intense rectal pressure, that urge to push. This is because the baby is so low in the perineum. You might hear her yelling out, "I have to push," or "this baby's coming now," or "I have to poop." No, it is the baby's right there at the perineum. So you will have that for your assessment. And then these patients, they have a really fast labor, so they're at super high risk for hemorrhage. The body just spit out a ton of contractions that were super powerful and strong. That uterus is worn out and tired, and now it's going to bleed. So they are at risk for this. And then also tears. So there's no time for that fetus to sit in the perineum and stretch that tissue. So she's more likely to have a tear because that baby just comes flying out. Our management for this patient is going to be to very quickly prepare for delivery. I can't tell you how many times these patients come in and quickly deliver within 5 minutes of being there. Everything is pure chaos. There's many times that the labor nurse even has to deliver the baby on her own. So we need to be prepared. So all supplies need to be quickly gathered and set up. You never want to leave this patient, so do not leave her, okay? You just call for help and get the support in there that you need. You don't want to miss this baby being born. The baby's going to come flying out, and you don't want to miss that. Medications. So this patient might not be able to get an epidural, and that might be a big panic for her. But some hospitals have other things such as nitrous oxide, or laughing gas, if the hospital is equipped with that, and the nurses are trained to use it, then the patient can use that just to kind of help take the edge off. Our education. This patient needs some very quick education, right? Because everything's happening fast. She needs to deep breathe. We need her to breathe so that the baby gets oxygen. We need her to stay calm. Very hard, but we need her to. We need her to focus on pushing when it's time. So these patients come in, they are so out of control, all over the bed, screaming. They don't know what is going on. Most of them wanted an epidural, right? And now they're not going to get it. So they are going to hate you. You really have to get in their face nicely and say, "Hey, you can do this. Focus and push." After the baby delivers, the mom is usually in total shock. She just sits there stunned. So this is the classic story. The baby usually also will be stunned. They just got evicted from their home and very quickly. So I say that the baby always has this "help me Jesus" look. They just stare. It means they just stare. They're stunned. They're not really crying. So they need to be stimulated vigorously to breathe and cry. So both mom are a little bit in shock. And that's okay. Everything happened to them, and now she's going to need to be educated on what just went on with her body. Our nursing concepts for precipitous labor are going to be safety and comfort. We need to ensure that safety is a priority during and after delivery, as well as provide comfort to the mom as she goes through this. So remember, she probably did want an epidural, or she at least did not want all of this to happen so fast. Her body's doing something very quickly, and she doesn't have enough time to respond and cope to what's going on. Our key points for precipitous delivery is that, remember that labor, it's under 3 hours from start to finish. It is so fast. Multigravida patient is a risk factor. If she has a history of fast labor, another risk factor. Hemorrhage and tears are going to be our maternal risk that we need to be assessing for. And then bruising and respiratory are the fetal risk. So the baby can get bruised on the face because it has suddenly been pounded by that uterus down the cervix, onto the pelvis structures. So there might be some facial bruising. And then respiratory, because they don't get that good squeeze. They just get really flown out of the uterus. So they might have a little retained fluid that they got to work through. Make sure you check out the resources attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.